Welcome back to Hot Flashes and Cool Topics. Today we have Asima Ahmad on, and she's the co-founder and the chief medical officer of Carrot Fertility. Now, when you hear fertility, you're probably thinking fertility, which it is, the importance of it. But another thing that Carrot Fertility is doing is they've done a lot of research and different studies about the importance of menopause in the workplace. So we're really going to get into that and talk about it today. But welcome to Hot Flashes and Cool Topics podcast.
I'm so excited to be here to chat with you guys today.
Yeah, the one thing I wanted to ask, first of all, before we get started, just a little bit about what Carrot Fertility is and some of the things that you do there.
For sure. It's obviously something that I love talking about. So Carrot Fertility is the leading global fertility care platform. We work with employers, health plans, and health systems to create a customized and inclusive fertility benefit that provides employees with that financial, medical, and emotional support that they need while pursuing, fertility care or family building journeys, as well as hormonal health journeys, which include menopause for women and low testosterone for men. And we do this with the goal also being a reduction in healthcare costs and improving clinical outcomes. So at this time, we're working with over 1,000 customers across every industry that you could possibly imagine in over 170 countries, and we cover millions of lives globally. And we have a very extensive network, actually over 11,000 eligible clinics, agencies, pharmacies, legal service partners, and experts around the world. So the largest network of its kind, because we want to make sure that our members are able to receive the care that they need in the most efficient way possible. So get the right care at the right time.
Is that also, do you work with insurance companies?
Yeah, we work with health plans and health systems. So sometimes if an insurance company wants to do like a kind of like a carve out fertility benefit, we can work with them as well. But most of our customers, I would say, would be employers.
Yeah, I know, Colleen, you brought this up off air before we came on about women and when they're going into menopause. Sometimes they're putting off having children if they want to have children. And they're coming into maybe right
They're
off of their
perimenopause, pregnant, menopause. It's like,
yes, like they're coming off of maternity leave and then they're entering perimenopause or they are in it and they're pregnant, just like you said.
Mhm.
What services can be provided for women in that situation?
So I think before I jump into that, I think you brought up a really interesting point in that the timing of when people are having babies is at a later age, or and we're seeing that globally. We're definitely seeing that in the US. And what that means is that they may be at a point where they're having a child where they are perimenopausal. They may have started perimenopause and had a child, or maybe that might start a little bit later. So the thing that we do at Care Fertility is when we think about fertility and lifelong hormonal health, we think of all of this as a continuum. It's not like a single point in time. It doesn't mean that, you're 20, you're going to have a baby. Then, you're 45 to 50, you're going to go through menopause. It's basically that no matter what age or stage of life you're at, we're there to support you. Because in some cases, and this is a great example, people will go through perimenopause or menopause early. They'll have early ovarian aging or premature ovarian failure or primary ovarian insufficiency. So an example is like undergo or go to become menopausal before the age of 40. And so some of these people will become menopausal first and then get pregnant afterwards. And that could be using donor egg or eggs that they previously froze. And then after they go through that stage and they're pregnant, so they have support through pregnancy and getting prepared to going back to work, and then they're menopausal again. So that's why when we think of it as a continuum. We're not like, okay, it has to be this stage first or that stage next. And that way the support is very comprehensive, it's very fluid, it doesn't seem disconnected. It's all just available whenever that person needs it.
it's also interesting because from some of the research that I've seen, menopausal women are the fastest growing category in the workforce. So this is something that is going to become more and more an issue for corporations. And it would really be incumbent to the corporations to say, what's out there? What do women need? And how can we best protect protect and encourage productivity at the same time. So
Mhm.
you've done some surveys, and what have you found have been some of the modifications that companies can make to benefit menopausal women?
So I'll talk a little bit about that, but I'll also tell you how they feel about it. So when we surveyed these women, the majority of them did not have benefits in place to support menopause. So just 24% say that their employer has any sort of menopause benefit in place. And of that 24%, only 9% said that it was significant. And there were so many, 60% said that if they had a really comprehensive menopause benefit in place, it would have improved their job satisfaction. And so it's not going to be like a one solution works for everybody. I think it depends on what your employees need, but it's important to have different options in place. So the way that we do it at Carrot is that members have access to, like, an unlimited access to online evidence-based education. They have the ability to talk to experts 24/7. And you know, sometimes it's like 2 a.m. when you need to you have the availability to speak to someone. So they have the unlimited access to that. And that could be through video, chat, text, whatever works for them. There's a virtual community, so they have the group support. And I think one of the biggest things is the specialized network that we have of providers, because what you hear quite often from women going through perimenopause and menopause is that it took them several providers. They went through several providers before they found the right person. It's not usually like, oh, I met the doctor, and it was the first doctor that I met with and I was great. So it helps connect them and match them with a provider that would best fit their needs, which I think is very, very, very valuable. And also there's the financial benefit. So people can use that towards treatments like hormonal therapy that might not be available through their insurance otherwise, because sometimes they'll have medications that have been around for a while that are covered, but maybe there's something new that just came out that someone's interested in. They have fewer side effects from it. It works better for their symptoms, but it's not covered. So they can use their financial benefit towards that, or even other treatments that might not be covered through their traditional insurance.
How would a company, or how do you get the message out to companies that Carrot Fertility is available for menopause and the workplace care?
So this is where I think that I tell people that anyone can make a difference, because for many of our customers, we'll find that it was that one person that went to HR and said, you know what? Like, whether it was menopause or whether it was like pregnancy benefits or fertility, like they had something that they needed, reached out, and because of that, them raising their voice, it was a benefit that was introduced. And it was then available to everyone around them. So it helped not only them, but also their colleagues. And so there is that power of the one voice. And I do want to encourage people to do that. But I understand that in many cases, it can be intimidating to be the only person going into that office. And maybe you want it to be a little bit more anonymous. So that's where it's important to also reach out to ERGs and go, there's the power with numbers, and you can also do that. And for someone, let's say, that doesn't feel comfortable, whether it's going alone or working with the ERG to go to HR, you can also go to the Carrot website and reach out to us. And we, like Carrot, the company, can then reach out to your HR team and talk about the benefit with them.
Okay. Yeah, that always, I wondered how that worked, because when I was going through perimenopause or menopause, I didn't even think about asking my employer, to have something there for me. What are some things that they do have that you have found that companies incorporate to help women in the workplace?
Well, before, actually, I wanted to go back to the one thing that you mentioned,
Okay.
was that you did not go and reach out. And I think that's a really important point to hit on, in that though this is slowly changing over time, people still feel that there's a lot of stigma around the topic of menopause. Like, they don't feel comfortable going to their employer and talking about it. Some of them feel that by bringing it up, that, and this is sometimes something that we see, is that people may transfer their biases about, menopause, it occurs as you're getting older. So they'll link it to aging, and they might transfer biases of aging onto colleagues. And so it's not uncommon that people are reluctant to disclose this with their, HR team, or bring it up as a topic. But I think that was really important that you mentioned that, because that was also something that a lot of our respondents mentioned. They mentioned that they experienced, because of these symptoms, and when in the situation where it might have been brought up, ageism. About 47% of them said that they experienced that. But yeah, in terms of like what employers can offer, again, like I gave you some examples of what we're offering through Carrot Fertility benefits, but I think like there's many different ways to do it. One is just like having leadership acknowledge it and maybe even share their experiences. I think that's a great starting point, because that helps, again, to reduce some stigma around the topic, and having empathy around the topic, around people who might be going through those symptoms, really goes a long way. It sets the stage for what the culture should be in that company. And then the benefits is like the added part to it, right? So first, helping to create a culture where you're providing support, that there's no stigma around the topic, and then on top of it, adding the benefits.
One of the things when I was getting ready for this podcast that I thought was interesting was that in February of 2024, the Equality and Human Rights Commission published new guidelines for menopause in the workplace. And those guidelines were like some of the things you were talking about: changes to a physical work environment, promoting flexibility, absences can be marked differently for
Mhm.
menopause versus non-menopause. Your as simple as, if you have to wear a uniform, the uniform can be modified, because a lot of women go through very heavy periods when they're going through menopause. And simple things that companies can do, not to point someone out and say, this person's getting older, they're going through menopause, red light over here, but to make it a we've heard from so many women and doctors who have said, told us stories of women who quit their jobs because the menopause symptoms were creating an environment where they could not continue working. So how do we get these companies to introduce the beginning? Just I know this is the beginning part of the conversation, but simple strategies to make women feel more included.
I think you brought up some excellent examples, right? Those are simple things that you can implement that doesn't make someone feel that they're standing out because they're experiencing these. And you're making it normal, right? It's just a part of the offering that you have for employees in your company. And for example, the example that you used, with the uniform being different, it could be somebody that's perimenopausal or menopausal who feels more comfortable using it. It could be somebody else. So it doesn't really, point out that person, and make them stand out amongst the crowd. I think the other thing that you mentioned about like being able to take off time is that is something that people have been doing over time. Like there were surveys, about 40% of them said that they took off time when they were experiencing these symptoms. And about 70% of them said that they took off about a week's length of work, or like about 40 hours, so about a week. About 30% of them said that they took around a month off altogether. And then of all those people that took off time, about close to 60% said that they had to conceal the reason why they did that. So when you have something set in place where you're able to take off time for, when you are having those symptoms, as you gave, that example, I think that's really, it's a great way for companies to support individuals.
I was reading the reports and the different things, and that you also, the reports mention how companies really lose a lot when they don't have these benefits in place. Can you talk a little bit about what the loss to the company is when they don't support women in menopause?
Yeah, so the Mayo Clinic had released data on American women that showed that menopause costs an estimated $1.8 billion in lost working time per year. So there's that financial part. But if you think about it, many of these women who are going through this, right? Again, we talked a little bit about early menopause, but most of them are in their 40s, 50s, and 60s. So for many of them, they are at the height of their career. So by having an employee that is feeling symptoms of perimenopause or menopause that's disruptive to their work, not only results in that financial piece, but like you could potentially lose an employee. A lot of women change their, and the surveys shared that they changed their schedules. About like, I think it was like 54% of them either changed their job altogether, went from full-time to part-time. And what you see is that if you offer support around perimenopause and menopause, you help to retain those high level employees that you have. It's going to cost you more if you lose that employee than if you put mechanisms in place to help to retain them.
You'll lose the experience, and then women could lose their livelihood if they feel like they're missing all this time off work, they're putting their jobs in jeopardy, and then their livelihood, and then that just snowballs into financial issues for women as well.
Absolutely.
One of the things that is interesting, I guess, to notice, I was a young attorney in my 20s, and back in my day, we didn't talk about getting pregnant. It just wasn't a conversation you had. As a matter of fact, my boss had a picture of a pregnant woman with an X across it, like don't smoke, don't get, yeah, I know.
And he
back
was
in
a
the day.
lawyer. I mean, that always
He was the
shocks
head
me.
of our department.
Doesn't
I
he
know.
know about that lawsuits?
So when I got pregnant, I was terrified. And they said, don't say anything for the first 3 months. I ended up spotting. So I had to, and I ended up job sharing, which was very unique for the 90s. Well, since then, the conversation has opened up so much. And there's so much more women are offered, men are now offered paternity leave, that we're it's now up to speed. Do you think the conversation on menopause is going to go in that direction as well, where it's so women don't want to talk about it right now, but as years go by and changes in our healthcare and hopefully women's health becomes a priority, that this will be a conversation that opens up possibilities for women?
Well, I'm going to make sure that it does. I think going with when people share their stories, whether it's a private company that's going out there to create change. I mean, everyone together, I think, is going to cause this change. And I think you brought up that perfect example with, the way people treated pregnancy,
Right.
how they view it now. And like, number one, you shouldn't be getting pregnant. Okay, number two, you can, and maybe you as a pregnant person can have time off, but why would we give your partner time off? And now the partner gets time off too. I think, yes, it may take a little bit of time. I'm hoping it doesn't, but I do see a lot of changes already taking place, even in the last few years, around just the conversation around it in the workplace, as well as like the support and the benefits that are being integrated in it. It's actually one of the fastest growing parts of our company. And most of our customers who already had the fertility benefit also implemented the menopause benefit as soon as it was available. So there's a lot of interest there.
Yeah, it's really interesting that they have that. I don't know if it's a change in dynamics or what's, as you said, Colleen, going forward with the talk of pregnancy, that generation said, okay, let's just move on with this. And I thought it was really interesting, some of the things that took place, what people in the survey said they wanted. And a big thing was flexibility. And can you talk about what flexibility might look like in a workplace?
Yeah, so we had on some of those examples, right? Where flexibility might be, so example, where someone, let's say they have to go into the office every day, but they have the option of, let's say it's just a bad day, they're feeling a lot, maybe they're having more hot flashes, or I just can't concentrate, I need to be in a different environment. They have the option of working from home. That's something simple. And honestly, the world together, we've gone through the pandemic. We know that people can work remotely from home and still be productive. So that's, I think, a great example of something that you could do. I mean, there's obviously many other things too, but I think that's probably one of the best examples.
Best ones. They said the menopause room too, or having a room, a
Yeah,
special
there's some
room.
companies that have a room that might
I
be.
want to work for the company with the menopause room. Because
Yeah,
they are so forward thinking and trailblazing that I just want to work for a company that would even consider doing that.
right.
That's incredible. Do you think the conversation with menopause, is it going to fall within the fertility protection of companies, or do you think it's going to be its own separate entity? Like, do you see fertility being a spectrum where we protect pregnant women and then we protect menopausal women, or do you see it being two distinct resources in a company?
Well, the way that I see it shaping out right now is that they're connected. But in some cases, let's say a company has something that they feel really works well for their employees for pregnancy, and they're like, well, we don't want to change that. We have really great reviews from our employees. This works great for them. For them, maybe it might be a separate entity, but in most cases, I see that they're viewing it as like just like I said with like Carrot, is that it's like a lifelong support or benefit offering that they have available. And it's important again to know that like it's those different journeys can overlap. It's not that one has to occur before the other. And so having something in place that really, really understands how all of them are interconnected and work together creates something that's more fluid and comprehensive as opposed to maybe more fragmented.
I'm curious what's a typical reaction when a company is approached with this? You know,
With
Does
the
it dep
option.
yeah, does it depend on the size of the company? Like,
Or
if
like,
a smaller
yeah.
company, are they just amenable as a larger company?
Yeah, actually, it doesn't matter what size the
Oh,
company
really?
is. That's one of the things that we wanted to do when we started off Carrot is we wanted to make the benefit something that's accessible for all like different size companies. Because when a lot of these fertility benefits were becoming available, they were larger, much, much, much like these very large corporations and big, big, big companies. And so because we've had a customer base that's included very small size employers and the very, very large ones, we've seen that across the board, there's interest there. They all want to help in some way, shape, or form. And the thing that we try to do is to create that option of customization for our offerings, in that sometimes the employer says that they want to offer a certain level of support, but maybe they can't do the financial part yet. So they have the option to slowly add that on over time, which is, I think, really nice because at least in that way, they're starting to bring some level of support in, and as they have more resources available, can build on that over time.
Have you found, I know corporations, and I'm putting on my hat when I was a public school teacher, so I'm thinking about government jobs, things like that. Have you found they're supportive as well, or state or government jobs?
Yes, they are. Again, you're going to find that it's not a one size fits all, and the same thing goes with the response that you see from them. But there has been, yes.
There has been. That's good. I was just hearkening back to my days too. And I was talking to my husband before I came on this interview today about a situation with me when I was a teacher, elementary
Okay.
school teacher. And I had to be on a bus on a field trip during a perimenopause, very, very heavy period for like 3 hours on a bus. I
Mhm.
couldn't get off the bus. I couldn't, then I have 20 kids to look after. I
Yeah.
can't just ditch and go to the bathroom and things like just support in that area. Back then there was nothing. Like I couldn't tell 22nd graders, sorry, Mrs. Garrett's gotta go. Are any solutions or suggestions for situations like that?
I guess I need a little bit more clarity about the question, like
Oh,
for the
about
individual or for
like
like
individuals, I
employees
just
and
think I
firms?
Are
know
you
that
saying
in
for like government entities, like
or
where should
just
a
like that, but
government
even
employee go
but for
to?
situations like I mean, teachers have to ask to even go to the bathroom. You're not
So
allowed to leave your class
That's a whole different
alone.
topic
It
of
is, it is,
school.
but that is a situation that
Right.
happens, and a lot of women are teachers, and you're
yeah.
not allowed to leave your classroom alone.
Mhm.
And that was the one to me. I was
Maybe
like,
that falls under the flexibility where they need to have
Yeah.
other teachers who can cover, like maybe
they,
they bring an
yeah,
extra person, an extra body that
yeah.
can.
I mean, and that's basically you'd have to yell down to send a note to a student. Can you
Right.
and the teacher would have to stand between the doors of the classrooms.
Mm.
But there are situations like that. And I know when I was reading about Carrot Fertility and the what you all provided in the menopause workplace, I was thinking about my workplace situations and how that was such a, I remember just thinking, when is this bus going to stop? I
Well,
mean,
in the medical space, medical space, we say like when we have a patient who can. So actually, this is actually a perfect example. So when we do embryo transfers, we require the person to fill their bladder up, and there's different situations like early pregnancy ultrasound. You want a full bladder to get the best imaging. And when one of those patients comes in and their bladder's completely full and they look super comfortable, we're like, you must be a nurse or you must be a teacher. Because
yes,
you don't have the ability to suddenly leave and be able to take care of yourself, whether that's, having a heavy flow period and being able to, change your sanitary pad. But I think that there's the flexibility piece that you brought up, but I think the other thing is, when you had to send a note, but with a student to like have a teacher stand in between the rooms to be on guard, the difference now is also that there's much more technology and ability to reach someone quickly. So hopefully in this case, you might be able to just text someone and be like,
right.
that's across the hall and say, hey, I just have to like run down the hall. Can you keep an eye on my classroom for 5 minutes?
Right. Yeah. No, but I felt like, gee, I wish school systems had these things in place. And and I think too, probably at the time, I would have been embarrassed to
Right.
bring this up.
Yeah.
I'm
Well,
hoping that's changing.
it's so complicated because when you're younger and you're trying to get pregnant, you don't have the stigma of the ageism. Like no one's surprised when a 35-year-old woman gets pregnant as an employee. But
Mm.
once you get to 50 and you're talking about menopause, all of a sudden there's that ageism stigma that
Mm.
is more complicated and would, I think, exacerbate the problem of not talking to your employers, because you don't want them to think that you're aging out of your job.
Yeah.
So hopefully, there's a lot of funding going into women's health right now, which is great to see. What would you say the next 2 or 3 years with this women's health initiative, the women's health funding, what changes do you see coming on the horizon for menopause in the workplace?
Mhm. Well, two things. First, you mentioned the ageism thing. So that was something that we saw with our survey as well, that 47% of them said that they experienced it, and 44 said that they experienced it more than their male colleagues. And women of color were more likely to experience it and receive criticism. So that was a really important point that you brought up. I do see things changing over time. I love seeing that there are these initiatives taking place, that people are speaking about menopause, the importance of doing research in menopause, as well as just women's health overall, and that there's funding and these initiatives in place towards it. When you think about how quickly we'll see change, I think it will take a little bit of time. I think like when you think about research studies, it's not that especially those really large randomized controlled trials, usually you don't see the data immediately. So it may take a few years before they're able to share that data, and that might create change. But overall, I think that the fact that people are investing in this space is already showing that change will take place. And maybe that will be on the level of just like how people acknowledge it and handle it like when it comes to culture, whether that's in the workplace or in other situations. But I'm very optimistic of what's going to happen in the coming years around menopause and women's health.
Oh, that's wonderful to hear,
Mhm.
because so are we. So,
We are. We
Doc-
are. Yes.
Dr. Asima, thank you so much for coming on. We will make sure to have Carrot Fertility in the show notes. So if anyone wants the link, you can just go to our show notes and we will have those as well. Thank you for coming on and talking about menopause in the workplace. These conversations need to happen more frequently in larger communities so that we can kind of make it less stigmatized, and it will be more women will come out and say, okay, I'm going through menopause, I'm still working, you need to help me get through this journey. So thank you so much for coming on.
Oh, thank you so much for having me. It was great being able to chat with both of you today.